Okay, hello everybody. We'll be presenting our Surgical Innovation Week presentation. We are Gregory, Harry, and myself, Leslie. So first, we are all digital health innovation students for the various backgrounds of psychology, AI, and physics. From that, our total mission for our project is to develop hospital-centered innovation applications to improve care and treatment. For our statements, we looked at things such as this class's interviews, personal experience, discussion, and lit review. So for our needs finding, here's how it went down. We did 20 statements each. From that, we picked our 3 favorite. Those 9 statements went through a weighted criteria such as patient impact, market size, feasibility, and cost. We can go through more detail later. And then the top 3 scores were chosen. We did research on our top 3, such as risk and benefits. And then, so here's what that looks like now. It's a lot of information, but I want to show you guys, we did the research on our top 3. And then from our top 3, we scoped them up and down. And then from that, we evaluated and we picked our final statement to be a way to improve electrocardiogram lead placement efficiency in myocardial infarction patients to decrease door to balloon time. So what is the medical need we are looking at? We are looking at acute myocardial infarction. This is also called ST elevation myocardial infarction, also known as a heart attack. We'll be using these terms interchangeably throughout our presentation. This is a very important leading issue in the world, for it's the #1 cause of death. In detecting heart attacks in any clinical setting, you need to go through an ECG process. And we found through different observations, such as an observational study I conducted, that the longest step in this protocol is attaching the leads to the patients. So we want to solve issues such as lead entanglement, preparing the patient, such as chest shaving, patient irritation, clothing, and cleanliness.
Now that we described the problem, it's time to talk about the population. We know that ECGs are a big problem, but they apply to many different cases and they're used for different populations. So by doing many disease states, specifically the myocardial infarction, we found that ECGs are always used for this type of disease. So we were able to choose this population, patients with myocardial infarction. It's also important to note that we noticed that there was a big market space for it of $320 billion a year in 2017. Furthermore, we were able to define our population specifically for the myocardial infarction in the hospital. We found that 2 out of every 1,000 Canadians experience myocardial infarction every year, with men being 2 times more than women. Furthermore, we were looking at solutions of how they're applied to this specific population. The existing solution is what you'll see in the hospitals. There's strings. However, there's many issues with it, such as cord entanglement. You have to shave the body for men. Now, there's a couple of solutions that have been done. However, they only solve one problem. And when we saw that, we noticed that there's a lot of room to sort of tackle this issue. Next slide. Okay, so now that we've defined the population, let's look at the current outcomes of this population when they're experiencing myocardial infarction. So first of all, every year, more than 70,000 patients with myocardial infarction are admitted to Canadian hospitals with 90% survival rate. Now 90% is a lot. However, despite that, it's still the leading cause of death. So it still is a problem, even though they've been able to increase survival rate exponentially. Furthermore, future potential growth, we find that the rate of myocardial infarction is increasing 1.7% every year. This is a study that was over a 10-year span. This is for individuals under 40. However, the largest prevalence of this is actually for people older, and this trend still holds for those people. So the problem is not changing anytime soon, so it's a problem that has to be faced. Next one. Now we're looking at the outcomes. So we have our problem is ECG lead placement, and we have our population, which is patients with myocardial infarction. So we're looking at the outcome. There's many outcomes we could improve. It's a long step. It's a long process to making it better. However, we found that decreasing door to balloon time is the best way to tackle it. Now, what is door to balloon time? It's basically when a patient enters the hospital and when they actually get a treatment for it. So we found, through a study that Leslie conducted with Dr. Afilalo, that time improvements between the 85th and 89th percentile are able to decrease the time by 1.67 all the way to 3.28 minutes decrease in procedure, which is valuable time for these patients. A further study showed that better outcomes for patients, if you decrease the time, there's automatically better outcomes for patients and decreased mortality. Evidence of this is if a door to balloon time is over 90 minutes, there's an increase in mortality rate directly correlated in the graph. Furthermore, if there's an hour delay in door to balloon time, there's an estimated 55% increased mortality. Next slide. Oh, now we're going to look at marketplace.
Exactly. So for the market analysis that we did, we found out the average cost of an ECG is around $1,000 to $2,000, with the leads being around $60 each. So for the global market for cardiovascular devices right now is currently at $59 billion. We have approximately 1 out of 12 Canadians that are living with a diagnosed heart disease that could benefit from this type of solution. And Canada has approximately 1,200 hospitals that would be able to benefit from this kind of solution. And as for our stakeholders, we have our patients and hospitals that have the emergency departments, operating rooms, and ambulances. Also private doctors and clinics, so anywhere we can integrate ECG machines where tangling is a problem. So as for our needs criteria, we have our nice to haves. So our nice to haves would be to have a solution that would not change protocols, that would be cost efficient, so that would be easily implemented. It would increase implementation into hospitals. As for our must-haves, we need to have something that would avoid entanglement of wires, decrease balloon times, and would be a dependable solution similar to protocols that are currently in place. As for our brainstormings of how we could maybe come up with a solution, we found that maybe we could find a wireless alternative that would maybe use Bluetooth technology, and so that's kind of a novel idea. And we also have LED, so these LED curves that would work over clothing and hair, so that would decrease surface preparation time.
Thank you.
So thank you all, and good luck semester.
We're not here next term. We're only taking the first part, so we wanted to say it's been a pleasure taking this course with you guys. Good luck.
Well, the solutions are out there already, right? There's several wearable patches, watches, medical grade that would measure ECG. So I'm wondering.
Yes, so there is other solutions. We mentioned it earlier. But something that was important that we tried to stress is that these solutions only solve like one problem, like chest shaving, and the other one solves wire entanglement, but neither do both. So if you solve one, you still have a need to solve the other.
Why do you need to shave chest for a watch? For something you put on the wrist?
Those are implemented in like hospitals. Like when you come to an ER, they're going to do an ECG on you anyways if you're experiencing chest pain. So this is meant for the hospitals, meant for the clinics, not really for the individual user.
True, the patches are more used in the hospital.
Yeah. Also, these solutions, while some of them are pretty innovative, right now they're not in use in Canadian hospitals. Very few are used in American hospitals. They're mostly Chinese innovations. So we saw that there's a market in Canada and the US to tackle that's not being solved by
Well, if you're really interested in that, there is a startup that has already a solution that's in Montreal, and they'll be very happy to have your help.
Yeah, what's the name of it?
Vital Tracer.
Vital Tracer.
For the research.
Thanks for letting us know.
And I'm their coach, so I'll be happy to introduce you if you want.
I know I'm asking you questions, but do they do Bluetooth? Do they do Bluetooth leads?
Talk to them.
Okay.
I think yes.
You think yes?
Yeah.
Okay.
It's a kind of watch that they were.
But I mean,
it connects to phone, I believe.
Okay.
I really will be happy to connect you, and they'll be happy to talk to you. They're very friendly.
For sure.
I just wanted to clarify a point we made. We weren't saying that the leads used in a hospital is a solution. We're trying to fix the leads in the hospital solution due to the entanglement and the use of having to have good skin to put it on. So just wanted to clarify that point if it was.
But just good work on breaking it down.
Thank you.
I think we have a few more.
Yes, a question over here.
Yeah, I like the way you presented your narrative was very nice.
Sorry,
Your narrative was very, very nice, and you seem to be having fun. That's nice. Very good. So when you put, I was wondering why you put your nice to have, in the nice to have, you put value there, in the nice to have, especially for something that seems to be quite a crowded market.
You're saying
So it
cost?
should be relatively cost effective, you put in nice to
I
have.
think that's due to our background of who we are. We are all have experience in medicine and not at all in this. This is our first business class.
Okay.
So I think that's more just due to our personal background, and we really wanted to help the people experiencing heart attacks the most. That is our #1 priority.
Awesome.
Yeah, that's it.
Also, because we did the analysis of that 1,000 and plus $1,000 to $2,000, we kind of assumed that given that the current prices, our technology, given that we're entering a new market, it would kind of give a price increase. So ideally, it would be cost efficient, but we have that in our next app because we don't know if it's something that we can absolutely integrate and still the must-haves.
Very good.
Any other question? Excellent. Well, thank you very much.